So, Gerald, I'm really glad you can make it in to discuss Annabelle's cancer. As I mentioned on the phone, I know the term cancer can be very frightening, but it doesn't necessarily imply a death sentence. Many forms of cancer are treatable, and though we may not be able to cure them all, we can at least achieve some form of remission.
That is so comforting to hear. I mean, we've been worried sick about this ever since we got our biopsy results in. Now, you mentioned chemotherapy. Does that mean she's going to get real sick and lose her hair like people?
Well, our goal in treating pets with cancer using chemotherapy or radiation therapy are a little different than with us. Given the relatively shorter lifespan of our pets, we put more of an emphasis on quality of life and less so on trying to beat the cancer, so we therefore don't hit the cancer as hard. So when it comes to pets, since many of the cancers aren't curable, we look to achieve that long-term remission as long as we don't let the quality of life suffer too much.
So not all cancers respond to chemotherapy.
Oh, no. I mean, some, for example, skin tumors do very well with surgery alone. There are still other cancers that we may start with surgery and then follow with chemotherapy or radiation. Some cancers are just not really amenable to surgery at all, or they may be inaccessible. I mean, for example, Annabelle's lymphoma, you really can't surgically remove everything. So for these, we just go ahead and start with chemotherapy. And unfortunately, there are still other cancers that are either so aggressive or have already metastasized so badly by the time the diagnosis is made that there really is no cancer treatment. We just work to try to keep them comfortable and pain-free.
I've really been amazed by all this ever since we talked because I really had no idea that animals could be treated for cancer. Is this something that all veterinarians do?
Well, oncology is a discipline in and of itself in veterinary medicine, and there are oncologists or board-certified specialists treating cancer, both at the university level and at the private practice level, who veterinarians such as myself who do treat cancer often consult with. There are many veterinarians, depending on the nature of the cancer, may choose to immediately refer those difficult cases to a board-certified specialist. I find it oftentimes challenging and frustrating, but overall, I think treating cancer is very rewarding for me.
Well, we've talked about it, and we decided to go ahead and proceed with the treatment. Where do we go from here?
Well, we can start as soon as you're ready. I mean, basically, the protocol I want to use for Annabelle is a weekly protocol. We will start each week with a little blood test just to make sure that she's doing well from the week before treatment. And if she does well, we will continue at weekly intervals. I have to tell you, from our initial laboratory work, she's really in good shape, so I don't anticipate any problems. So we'll be good to go. We can start anytime you're ready. Cancer is a very serious disease, but one that can be managed. I urge you that if your pet has been diagnosed with cancer, to speak with your veterinarian or a veterinary oncologist as soon as possible. I think you owe it to yourself and to your pet companion. Best of luck to you. For Pet Care Television, I'm Dr. Jeff Werber. We'll be right back.
Thank you for watching our video. Please take a moment to visit our websites. Dr. Deborah Garrison at the Treshweek Veterinary Clinic, loveyourdog.com, loveyourcat.com, tvet.com, mypetcaretv.com, and petdocsoncall.com. Thank you, and we wish you and your pet a happy and long life.